Hi, I'm Jason Cart, and this is Jason the PT. This is a blog dedicated to bettering physical therapy and getting patients the results that they deserve. A little bit about myself. I've been a physical therapist for 12 years. I did my undergraduate at Syracuse University in health and exercise science. I got my doctorate in physical therapy from Mass General Hospital Institute of Health Professions. I'm a certified manual therapist through the North American Institute of Manual Therapy and a certified myofascial trigger point physical therapist from MyoPain seminars. I've worked for Harvard Sports Medicine, a bunch of corporate physical therapy clinics around the Chicagoland area, and for the last 8 years, I've been the owner of Core Physical Therapy. So, what is Jason the PT? Jason the PT is a blog that's dedicated to advancing patients' knowledge so they can get better faster. The world of health, rehabilitation, and physical therapy is a humongous sphere, with a lot of people out there saying a lot of different things, which creates a lot of white noise, and patients that are having difficulty trying to figure out who to listen to. I've also noticed there's a humongous and overwhelming amount of information about muscles. But I think that's only part of what's happening in the rehabilitation world. Part of this blog is dedicated to moving patients away and giving them a more comprehensive view of what's going on with them. It's more than just muscles, it's more than just soft tissues. In order for patients to get the best result, we need them to be able to look past that and find the root causes of their pain. Secondly, by increasing your knowledge, I can make you a better consumer. Physical therapy is an investment. It's an effort in your time, your effort, and your money to reach a certain goal. And as providers, we should be sensitive to that investment and making sure we get the patient to where they need to be in a reasonable amount of time. It's no secret that the healthcare insurance industry is a disaster area. Patients are paying more and more per visits. They're also being limited on how many visits that they can have. We need to do better and treat more comprehensively to get patients to those goals. So part of this blog is going to help you make better and more informed decisions about how you receive your physical therapy, be able to synthesize the information that's being told to you so you can make better decisions all the way around. And lastly, because there's a humongous sphere of people within the health and rehabilitation world, there's a lot of white noise, there's a lot of static. Some of it good, some of it not so good. So I want to be here to bring a more common sense approach to physical rehabilitation. I want to help you dispel some of those myths that are long and lingering, get people off the internet and get away from the marketing aspects that are geared towards you to have you consume those resources, those healthcare resources, which is essentially to make you spend money. So if you want to get better smarter, the more information and staying away from the fluff and the marketing clits will help you be better, faster, and cheaper, which is important. So today what I want to do is demonstrate one of these concepts and convince you it's more than just muscle dysfunction. We're going to take a look at a patient today that's experiencing some right hip pain as well as some right low back pain. He has some profound weakness, but there really isn't a whole lot of reason for it. So during this case, I'm going to walk you through how it's more than just muscles and that we need to appreciate some of the things behind those muscles that are contributing to the problem. So here's the case. All right, so we have James here who's actually been having some right gluteal muscle pain. Now he's an avid lifter and he's not doing anything asymmetrical, but what we're seeing is a decrease in right gluteal muscle strength. So James, go ahead and bend your right knee for me. And what I'd like you to do is go ahead and mule kick. You're gonna lift your thigh right up off the table, okay? Hold right here for me. Don't let me push you down. Hold it. You can see I'm not doing very much here. I'm actually just using my arms and pushing James down, okay? So I'm getting collapse of those right gluteal muscles. So let's go ahead and compare that. Go ahead and straighten that one out for me and go and bend the other one, okay? Go ahead and mule kick for me. Lift all the way up. Good. Hold right here. Don't let me push you down. So here, I'm actually leaning on him big time, and I can't really collapse him. So we're seeing a significant difference in gluteal muscle strength from left to right, but we don't have a reason for it. There's no reasonable explanation why this patient would have gluteal muscle weakness on the right, unless, of course, it's not a true muscular thing. So you could actually get some muscular weakness from a neurological area. So every level of the spine has key muscles that it goes to. The gluteal muscles run off of L4, L5, and S1, which is the common place people will have a segmental dysfunction, or some kind of low back pain. So to demonstrate this, what I'm going to do is just going to put some vibratory input. And the reasoning behind the vibratory input is that it'll decrease that that neurological inhibition. So the glute muscles and everything sends signals up, and then the brain sends everything down, but there's a clouding of that signal. It's going to present as weakness. So we're going to do some quick vibratory input over that area where he's having problems, and then we retest. Is there any pain with this?
No.
Perfect. It works very similar to kind of like when you whack your elbow and then you rub it. It hurts, so you start rubbing the area and it kind of feels better. Now you're not fixing anything, but what you're doing is changing what your brain is paying attention to. So by putting vibratory input over those segments, what it does is it amplifies that signal. And if James gets stronger, it tells me where that weakness is coming from. If he doesn't get better, it tells me two other things. Either he has a massive disc herniation in his back, but he's not presenting that way because he walked in under his own power, and he doesn't have any symptoms down the leg or anything like that, or he truly does have muscular symptoms. But again, that doesn't fit our pattern. Doing okay?
Yep, doing great.
Perfect. Okay, go ahead and bend this knee again for me. And go ahead and mule kick. Go ahead and lift up off the table. Hold right here. Don't let me push you down. And now I'm actually on him. I mean, I'm really leaning on him, and I can't break him. So with that kind of finding, that tells me where this weakness is coming from. It's actually coming from the lumbar spine. L5 and S1 are being antagonized, and that's decreasing the signals up as well as down, and it presents as muscular weakness. You can also find, certain little other things with that problem. If you're talking about patients that have chronic hamstring tightness, well, your hamstrings are weak hip extensors. So if these hamstrings, and especially on James, if you kind of just go over them, he's got a lot more bulk here than he does here, which gives me the idea that he's been compensating for some gluteal muscle weakness by using his hamstrings. And that can lead to patients having chronic hamstring tightness. So these are the interesting little findings, but it's one more reason to say we can't just blame the muscles, because this muscle is the end result of other process. This is just the speaker. We have to account for the wires, the nerves, as well as what's going on in the brain, the amplifier. So this is just a small demonstration about how some low back pain can actually contribute to that muscle dysfunction. It doesn't happen and play out just at the glutes and in low back pain. This can also be a contributor to knee pain. If those glute muscles aren't firing, it can also contribute to some knee dysfunction. So you have to look away from the boo-boo spot in order to be able to find where this is actually coming from. We're going to be talking about these concepts and more as we walk through our Jason the PT experience. At the end of every episode, I want to give you guys some action items, some things you can actually take out into the real world and use to help make your physical therapy go quicker. Because whether you're having treatment here with me or in Red Bluff, California with somebody else, these are things that you want to start paying attention to. Number one, if you're experiencing muscular type symptoms and you don't have a real reason for it, question that. Because there are things behind those muscles that can cause them to be dysfunctional. The muscle didn't just go kablooey. There's a reason for it. Now, if you tore your hamstring playing soccer and you were kicking a soccer ball, that makes sense. That might just be a muscle problem, but you would have told us that. But if you're not saying that and you're just getting these things, question its origin. Secondly, if you're in physical therapy and you're getting a lot of muscle-centric treatment, exercises, soft tissue, massage, Graston, ASTIM, any of those things, dry needling by itself, any of those things, you want to take a look and question why we're just going after those things. And if you're not getting an answer that you're expecting, question that. Challenge your physical therapist. And lastly, one thing I did in the video with James is something I think a lot of physical therapists should do. It's called test, retest. If we're doing something to you or there's a dysfunction, we found that gluteal muscle weakness. We tested that. We found it. Then we did some things to see if we could make it better. And then we retested it. Every physical therapist should be doing that. So you should expect that, because in some pathologies like that, it was pretty stark. And we know now with what we're doing, we're going to make some progress forward. If you're not getting that test retest every visit or every so often, you need to question that, because if you're not getting it, then how do you know that you're moving forward? Now, please take, in light of some pathology, some people with very acute back pain, with a very cranky knee, you may not necessarily see that stark contrast from test to retest, but that's something you should be paying attention to, because if you're not, you're just flailing around in the clinic. I'm Jason, the PT. We'll see you next episode. We're going to do a episode 1 aftercare, where we're going to talk about some of these concepts a little bit more informally. See you next episode.